Hey everybody, it's Alyssa here, and today I wanted to bring you part one to a two-part series that I'll be doing on my veterinary nursing pet peeves. For those of you that didn't know, I am currently an emergency room veterinary nurse for small animal, and then I also do work per diem at a large animal school, as like veterinary school as well. I don't work there as often, it is per diem, and that's kind of ER ICU for large animal. This doesn't really follow those guidelines. These are more targeted towards the small animal side of things. So to start off, number one would have to be when you're taking x-rays. For those of you that aren't in veterinary medicine or don't know or don't have x-rays at your practice, most of our x-rays that we do take are on patients that are awake, and we do have to restrain those patients. Sometimes we do have to give them some sort of sedative just to get the x-rays in and done, because some patients, they can be uncomfortable. You do have to lay them like on their side for one of them. They do have to sit still for like 10 seconds. Other ones you do have to put them on their back in a trough for, and a lot of times they don't like that. Obviously animals, their prey position is on their back, so where their predators can like eat their insides, which is probably too much information that you guys didn't really want to hear right now. But anyways, when you go to take x-rays, one of the biggest pet peeves is when you think your x-ray is gonna be perfect. The patient sat fine, positioning was great, yada, 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 and the x-ray is crooked. And then you have to take it again. It's not a huge deal, but it is just like a minor pet peeve that me and some of my coworkers have discussed multiple times before. The next one really only does apply for emergency situations in, say, the ER. A lot of times after we fully triage a patient, especially if their patient is critical, it's coming in having seizures, ingested something bad like rat poison, Advil, they're suspected to have bloat, they are even in cardiac arrest, that kind of thing. We do have to ask for a verbal permission, at least at my hospital, a verbal permission for about $300 to $500 to get them initially started and stabilized before the doctor can call them. So that ultimately gives the doctor permission to spend about $300 to $500. So it would include the ER exam, any initial blood work. It could be x-rays depending on the situation. It could be like inducing vomiting if they ingested something. It could be getting them started on with an IV catheter and on fluids, and or like a quick look ultrasound. There are a lot of things that $300 to $500 could cover. It depends on the situation, and it is important for us to know whether our clients can afford that or not, based on the further treatment that we can do. If their pet comes in and they are extremely critical, like it is, like we've had patients that I've had where I had a dog come in and he was actively seizing for 45 minutes. At that point, we do have to place an IV catheter and give them anti-seizure medications to help stop the seizures. And that medication in injectable form can be pretty expensive. And then it was like, I had talked to these people, they did give us permission for that $300 to $500, and I always tell clients, like, you do have to pay that today. Unfortunately, because of ER, we can't like bill later, like it doesn't work that way. And they gave us permission, and then we find out like 2 hours later when we wanted to admit the patient that they really can't afford to admit him, so we were going to do outpatient care, and then we found out that they couldn't pay for the stuff that we had already done, which was like, I think like $250 or something. We hadn't even reached that 300 yet, and they couldn't afford it, which is really sad. And that is one of the biggest downfalls in veterinary medicine, especially in America. I can't speak for other countries because I haven't worked in other countries as a veterinary technician or veterinary nurse, but that is something that we do deal with a lot, is having our clients not be able to afford care for their patients or for their pets, our patients. So those are very sad situations depending on how critical that can be. And then, like, so that's one of the pet peeves, like, not necessarily that people can't afford it, because that's understandable, but it's the side of things that when we ask that, they do give us permission, and then when we do have to tell them that they do have to pay it today, they try to come back and tell us, well, you're only in it for the money. I have never met a single person working in veterinary medicine, and I have worked with, I would say, 50 to 100 different veterinary technicians, veterinary assistants, veterinary nurses, veterinarians themselves, veterinary surgeons, cardiologists. I have met so many people in veterinary medicine, and not one of them has been in it for the money. Realistically, people don't think about this, but veterinary assistants pretty much make minimum wage. Depending on the states that you work in, veterinary technicians make a little bit over minimum wage, and obviously depending on your qualifications, if you have your, depending on your state, you've passed your VTNE, which is your veterinary technician licensing exam. If you've passed that, and then you can get like certified, registered, or licensed in whatever state that you work in. I know for me, when I got hired, I was making $15 an hour. I work in Massachusetts, where minimum wage right now I think is 12 or 13. Don't quote me. I'm not 100% sure. But starting off in this company, I was making like 15, 25, and then I was told that if I got my CVT, which is your certified veterinary technician, which is the certification in Mass, once you pass your VTNE and have gone through schooling, that I would go up $1. That's it. So, but if you've been in the industry for years and years and years as a veterinary technician or veterinary nurse, you definitely can make more, get your VTS, which is your veterinary technician specialty, depending on what area you prefer. You can make more money doing that. Those certifications are long, and they do require a lot of money and time and everything. And then for the veterinarians themselves, one of the biggest reasons I didn't want to go to vet school was because people don't realize when, like, say human medicine, when you go to become a human doctor, yes, you take on a lot of debt, but you're also making thousands and thousands of dollars a year that you can help towards paying that debt off. Every veterinarian I've talked to has rarely had probably around $300,000 in student loan debts from vet school, and all of them say, like, you pay it for 25 years and you can get loan forgiveness, but you still have to pay like 75 grand in taxes on that. So, like, that's not financially free. That's why I personally, one of the biggest reasons I don't want to go to vet school. And every veterinarian I've met is constantly paying off their student loans, and they're not in it for the money. Like, they could have done a million other things. They could have been a CEO. That they wanted to do this to help animals or whatever else drives them. We're in veterinary medicine, we're not in it for the money. I can guarantee you that. But we don't have insurance like human medicine does, where they can bill insurance and they get that money back. So you don't necessarily have to pay your $10,000 MRI up front, where you do, and I'm not sure exactly how much MRIs are in veterinary medicine. They are not that much, I don't think. I also don't work in a hospital, in a facility that has an MRI, so I'm not 100% sure on that. But in veterinary medicine, you'd have to pay that out of pocket. You don't, most of the time. There are pet insurances and everything, but a lot of people don't have them. You do have to pay it out of pocket. We're not in it for the money, I promise you that. The next thing that's a pet peeve would have to be unreliable or lazy coworkers. Not saying I work with any of them now, but I've had coworkers in my other job that wouldn't take charts, wouldn't take cases. They have like 2 or 3 cases a day, and I'm sitting here and, like, I've had 15 cases, which a case is a patient, or depending on it, like 2, if like 2 quill dogs come in or something. Where I've had 15 cases and they've taken 4, and my doctor keeps asking me more and more questions on, like, have these estimates been gone over? Have these treatments been done? And, like, I'm stuck because they're not taking more cases. Also, the unreliableness of having people call out all the time. I understand sickness, family things come up. I just really don't like lazy and unreliable people. It just sucks. Like, just don't do things half-assed. Just do your job, please. Please. So another one of the biggest pet peeves in veterinary medicine as a whole, which pretty much has happened to every single veterinary nurse out there, probably every single doctor, is when you go and you're like, hi, like, my name's Alyssa, is this Fluffy? I don't know, I'll just use a random animal's name. Is this Fluffy? And they're like, yeah. And I'm like, okay, would I be able to take a peek at her really quick? Would I be able to get vitals? And then I'm like, are they friendly? Like, will they let me touch them? And they're like, yeah, go ahead. And then as soon as I get like within a foot of them, they like lunge at me or they growl at me and they're like, oh yeah, you're probably gonna need a muzzle. Like, you couldn't have told me that when I asked if they were friendly. Like in veterinary medicine, like I would rather have a client straight up tell me, yes, my dog needs a muzzle. My dog does not like strangers, does not like to be touched. They're fear aggressive. They're a resource guarder. They don't like other dogs, that kind of thing. I'd rather be told that up front because I can better prepare for those situations rather than have, like, we're not going to judge you. Like, unless you have like a 2-month-old puppy that is trying to bite our fingers off and you haven't worked on any treatment, maybe not 2 months, maybe like an 8-month-old puppy that is very mouthy and tries to bite us, there might be a little judgment there. You just need to work on training, which can be fixed and like remedied later on. But if you have like, I don't know, like a 5-year-old lab and they are just not having it and they just really don't like people, like strangers, apart from like the people that are in their family, and they're like, hey, they usually get muzzled that are regular vet, like he doesn't like for strangers. I appreciate that. I will 100% respect you for that. But if I go to touch your like 2-year-old Chihuahua and I'm like, are they friendly? And you're like, yeah. And then I go to touch them and they almost bite me. And then you're like, oh yeah, they usually have to be muzzled. Like that's something where it's like, okay, lost a little bit of respect at that point. Like you could have given me the heads up. Like clearly you knew. And it's just something where I'd be like, please just tell me. We just want to know. We're not going to judge you. Just tell us, please. Another pet peeve that one of my coworkers, I'm not going to name her because I didn't ask her if she wanted to be named. I texted them and I was like, give me your pet peeves. We were like in this whole group chat. It was great. But she said, which this has happened to me multiple times and I didn't even think about it. But she said, when you feed, like when you actually get the IV catheter in a dog that like multiple people have struggled to get a catheter in, you get that catheter in, you're taping that catheter in, you're like, yes, this is great, we're gonna get him all set, get him admitted, we're gonna do his procedures, yada yada yada, and then he accidentally just goes like this and just rips it out of his arm. It's great. Yeah, it's not fun. When that happens, you're just like, okay, it's somebody else's turn. Let's get a Band-Aid and start over. So another pet peeve is, like I mentioned earlier in the video, a lot of times we do give the dog some sort of pain medication or sedative before we take radiographs or X-rays on them to help keep them calm, and it's less uncomfortable for them, and it'll be easier for us to take X-rays, draw blood, place an IV catheter, all that kind of stuff. It is one of the biggest pet peeves for veterinary nurses when you're like, hey, I have a 150-pound Great Dane that we have to get abdominal X-rays on. This Great Dane has to be on his back and on his side, and we're gonna have to take like 6 views of him. He's not gonna like this, first of all. And second of all, he's ginormous. So us trying, even 2 people or 3 people trying to like get him into position is hard. And we're like, hey, would we be able to have a sedative? And the doctor's like, no, I'd like you to try without it, for no apparent medical reason. We're like, hey, can we have a little like methadone or something? We're not asking for any ketamine or Dextome or midazolam, but like some Torb or like some hydro, like something. And they're like, no, take the X-rays. And it takes like 20 minutes. X-rays don't usually take that long. X-rays should be in and done within like 15 minutes max. And it takes like 20 minutes to get these X-rays. You have your X-ray gowns on. You're like in there, you're sweating. You're like not breathing well at that point. Especially during COVID with the masks, it's great. And you're like wrestling this dog trying to get him to like lay on his side, let alone his back. And then the doctor comes over once you like have taken the X-rays, and you're looking at the X-rays before the doctor comes over being like, these aren't good, but we can't get anything else. Like we've taken 9 X-rays at this point. Like there's nothing else for us to do without any drugs. And the doctor comes over and the doctor gets mad at you because the X-rays aren't perfect. Like, as veterinary nurses and veterinary technicians, and even as, like, I'm assuming human nurses, like, we can only do so much to patients that don't want to have it done to them without drugs. If I was a dog and somebody tried putting me on my back to, like, take a picture, I'd be pretty freaked out too. I would probably try to bite somebody. That's just me. But, like, putting yourself into the perspective of the animal, like, that sucks. Another pet peeve, this is a really quick one, is at my ER. We don't get breaks. We work 9 hours straight without a break, and on Saturdays and Sunday nights, kind of sucks. So thank you guys for watching the part 1 of this 2-part series of my veterinary nursing pet peeves. Please like and subscribe, and leave any other video ideas or suggestions in the comment section down below, and I'll see you guys next time. Bye.